Hi, everyone, and welcome to Medium in Conversation. Thanks so much for joining us today. I'm Sarah Collins. I'm the editor of Elemental, which is Medium's health publication, and I'm really excited to welcome Andy Slavitt as our guest, especially at this pivotal moment in the pandemic. So just a little background on Andy. Welcome, Andy. Can we hear you? Okay. So Andy has decades of experience in healthcare leadership. He is the former administrator of the Centers for Medicare and Medicaid Services under President Obama. And he's on the board of the United States of Care, which is a health advocacy nonprofit. He is also an advisor for the Bipartisan Policy Center in DC. And on top of all of that, Andy has been all hands on deck during the pandemic. He hosts a podcast called In the Bubble, which Apple just named one of the best podcasts of 2020. And he is the author of the forthcoming book, Preventable, which is a behind the scenes look at the US coronavirus crisis and response. That's out in March, so mark your calendars. And then there are his daily posts. So since day one of the pandemic, Andy has been reaching out to his vast network of healthcare experts, politicians, scientists, you name it, and broadcasting intro through Twitter threads and through Medium posts. These posts have helped millions of people cope and navigate through the pandemic every day. And for those of you who aren't following Andy already on Medium and on Twitter, I strongly urge you to do so because they are a massive public health service. So before I start the questions, I just want to make one note that we are hoping to do a few Q&As at the end of this talk. So if you have any questions you want to drop into the chat, my colleague Alexandra Sifferlin will be collecting them. She is the editor of the coronavirus blog on Medium, so you may know her as well. So Andy, hi again. That was a long lead up, but I had to make sure that I got everything that you do.
You forgot that I'm like really hysterically funny.
No, I actually had that in there, and then I thought I didn't need to lead up with that because you'll just prove it during the talk. So
I know.
I'm sorry. I want to start with your daily threads first, because take us back to those early days of the pandemic. What compelled you to start reaching out to experts and writing these posts? And what were you hoping to accomplish?
So I had just like incredibly busy days, and I was talking to all kinds of people. Remember this back in March, which wasn't that long ago. Nobody knew anything. It's, now everybody's an armchair epidemiologist, and we all know curves, and we all know this, we all know that. But the administration wasn't saying a lot, and what they were saying, it was hard to know what the reality was. And so I was just talking to hospitals in New York, talking to scientists, talking to politicians, talking to labs about how long things were taking. I pick up the phone and call people who are manufacturing ventilators, and then that's one day I just basically put it all on a thread. I'm like, this is what I did today, and it had like 10 million or so impressions or something like that. And I was like, okay, well, so I did it the next day, and then I did it the next day, and I realized that people were lacking kind of really transparent information in a way that was usable. And over time, I think as people have had more basic information available to them through reliable sources, I've kind of gone away from providing facts and more towards what I'm learning and towards impressions, and so I don't drive everybody completely crazy.
Well, you're not driving us crazy. You're helping us a lot. And now you're 10 months into this and you're still doing it. So how have you not managed to spiral into just like a pit of despair and rage at some of the things you're learning?
I never despair, maybe sometimes rage. There are things to be angry about, but even though then I think you catch yourself and realize that, how much of it is anger at just frustration at the situation. I'd love to be able to sit here, Sarah, and say, look, everybody's doing the best they can, and therefore we have to be a little bit charitable. And I would love to feel that way. I actually don't feel that way. I don't think everybody involved has been, of pure instinct and trying to save the most lives. And look, if we were out there doing our best and failing, but I felt like everybody was out there prioritizing trying to save people's lives, then I'd be very charitable to that. But there are things you run across, and people you run across who have other agendas that they're laying over this. And then I think occasionally you get angry at just the way things are in the country, that things are unfair for certain people, for farm laborers, for people in jails, for people in nursing homes. And as you go run across that stuff, it makes you want to call attention to it and want to make it better. Look, those things, a lot of those things were true before the pandemic. They're true and worse during the pandemic. And I think it's up to us whether they'll be true after the pandemic.
Great. Well, I want to dig into some of that today for sure. I want to start though. The theme of this talk is that it's darkest before the dawn, which I shamelessly stole from your recent podcast with Dr. Ashish Shah, because I think it's such a great analogy and so true right now. So I wanted to start talking about the darkness that we're currently in and then move into the dawn. As of today, more than 283,000 Americans are dead. Cases are spiking in nearly every state. Healthcare workers and hospitals are overwhelmed. Public health experts are exasperated. And then you have the pandemic deniers and the anti-maskers and our current president. And as you've said, we aren't just dealing with a pandemic, we're dealing with a society who doesn't know how to deal with a pandemic. So in a nutshell, just in a few sentences to start, like, how did we end up here?
Look, I think there's a couple of things that about our society that are become real challenges in the pandemic. You know, if you wanted to pick a country where you say, where's the easiest place to make $1 billion, if that matters to you, you probably say the U.S. is at the top of the list. But if you wanted to pick a country where, you know, we had to rely, our weak link was how much collective commitment we had to one another to save lives. Unfortunately, we wouldn't be at the top of that list. You know, we're a country that's not used to sacrificing. So, you know, if I don't have my Starbucks in the morning, you know, I'm cranky, right? Whereas my grandparents and all of our great grandparents went through the Depression. They went like 3 years without coffee, right? You know, to send to our troops. I mean, so we're a little bit privileged in not dealing, and we're inexperienced. We've never dealt with a big global health crisis like this in mass. It's the kind of thing we think happens to other people. It happens in Asia, it happens in Africa. So, you know, one of the premises of my book is you have two lines of defense. One of them is your kind of technology and your government and your the CDC. And if that works, as it always has for us, it's great. But your second line of defense is each other. And that's where I think we've really fallen down. And so without even mentioning Trump, without even mentioning what I consider to be very bad leadership, we have some endemic flaws as well that we have to face up to. Yeah,
I think that in this time that's, you know, when everything is so serious and scary, you know, what do the next 6 weeks look like for us? And what mindset can we have to get through both safely and sanely?
That's the best mindset is it's only 6 goddamn weeks, right? I mean, like I hear some, you know, in the wrong context, like 6 weeks, right? If my 18-year-old talk about it, it's like, Dad, that's by that time, you know. But when you look back at look at 6 weeks ago, right? 6 weeks ago wasn't that long ago. 6 weeks from now seems far, but 6 weeks ago, it doesn't seem that far. And so we have to kind of understand that what we're asking each other is not unlimited. It's hard when it's unlimited. And look, if you want to be busy doing something, be supportive of the people that need it. And if you need help, by all means, ask for help. Ask the people in your life for help. And if you could provide people some help, do it, because it's been challenging over the holidays, challenging during the winter. You know, it's not, I don't want to make light of it, but it is much more dangerous out there than it looks. I think that's the thing we have to understand is things that you can do the very same thing that could have been safe in September, and you do the same thing today because the spread is so much higher in most communities, in all communities. The same exact thing today is more dangerous. And the people that are out, if you went to a restaurant today, not only are more likely there to be people in the restaurant that are infected, but the people in the restaurant are people who are less likely to care because they're dining out a lot. So it's just hazardous, and our minds don't quite connect to this because it's invisible. Like you look outside, it's not a dark, you don't see the wind whipping through, you don't see flood waters, you know, the governor's not standing there in a plaid shirt and a megaphone yelling to get off the beach, right? You kind of need, we kind of need those visuals sometimes, or we don't connect.
Yeah. And how are you guys, the Slavitt family, how are you navigating right now? Like, what are you doing? How careful are you being?
We're careful. I
Yeah.
mean, we're careful. I mean, we all of us have had pre-existing conditions of some sort. All of us are like slightly at risk. We're not hugely at risk. And look, I'm not going to lie. We're the privilege to be careful, and it would be very irresponsible if we weren't, because there are people that are forced to see us every day. They work at the grocery store or whatever. They should not be forced to see us without a mask, because they don't have a choice. We have a choice. I mean, the people in this country that have a choice, the separation between those who do and those who don't is enormous. Um, and, um, you know, I mean, in my book, I interviewed a whole bunch of different people. One was this guy who works in an Amazon warehouse. Not only did he get COVID at Amazon warehouse when he was forced to work, but then when he got sick and he couldn't get a test because there were no tests, they stopped paying him. And, so he had to get back to work as soon as possible. So for any of the rest of us that aren't in situations like that, I would hope we would be realizing how privileged we are, and then doing everything we can to just help out those others.
Yeah, that actually brings me back to the analogy about it's darkest before the dawn, and that it is really a bizarre time. That we're in this terrible spot, but there is a guaranteed light at the end of the tunnel, and soon. It's just a very strange place to be. And you tweeted about this, and you said, "What will I regret not doing once the dawn is here? Knowing with good certainty that soon enough will be out of this is a gift of sorts." So you've sort of touched on this, but I would love for you to do it a little bit more. Like, how do you intend to use the remaining time of the darkness in a meaningful way?
Right. Let's look at the thing about that expression, which I appreciate you giving me credit for, but we obviously, it's been around for a long time. But it's really interesting because when people usually say it's darkest before the dawn, they're usually trying to tell somebody, hey, I know it seems bleak, but keep going, it'll get better. But they don't know when it'll get better. We are in an amazing situation where we actually have really good confidence that over the course of 2021, because of the vaccines, things are going to get a lot better. And what that should tell us is, okay, we're living through a historic period, but there's a limited window. And what do we want to do to take advantage of that window? And I just think, and maybe it's my own obsession, but I just think about all the people that die every day. And it's like every death you can prevent, any bit of despair you can prevent. And I don't distinguish between people dying from COVID or people who are upset and have addiction challenges or people who have any kind of challenge. Those things are going to be better soon, I hope, but we've got to help people get there. And so I just view it like it's just an amazing opportunity in whatever way any of us can in our community to reach out and help people. And as I said, sometimes you're not in a position to help people. You may need help, but you have to ask for it. And I think there's nothing more encouraging and empowering in the human condition than asking someone for help or hearing someone's ask for help and knowing you can help and doing that. And we started out that way, I think, in April, but we got a little bit away from this in the last few months, and as we sort of turned against each other. And I think we just have to not worry about, people say, well, what do you do about the people who don't believe in this? You don't do anything about it. When does it make sense to worry about the things we can't control? And if there's people that are going to, be doing stupid things, the chances of us changing their minds are pretty low. And when I come across someone who is in a situation where they're less than, good about these things, I don't know. I guess I advise people that when the dawn comes, are you really going to want to break your relationships with your children, with your cousins, with your friends over a temporary situation? And people don't like to be judged. So it very rarely works anyway to, glare at people who aren't wearing a mask. So I don't know. I think we got to start focusing on the people. We got to start focusing on each other. And I think that's going to be at least helpful in the smallest ways.
That's great advice. I mean, I think as we move into the dawn in this conversation, we know that the two things that will get us there are vaccines and a new administration. And so I want to talk about both and start with vaccines. First, despite the ineptitude in America's COVID-19 response, there's a lot to be proud of when it comes to vaccine development. And I wanted to know what stands out to you about the development process.
The career civil servants, like Peter Marks at the FDA, like Rick Bright at BARDA, Tony Fauci certainly at NIH, they have been part of the reason why we gotten where we gotten is, Rick Bright made an investment in this messenger RNA platform in 2017, and Peter Marks came up with this idea that we would embed government people on each of the best pharmaceutical teams, so that we wouldn't have to do the back and forth of the submissions to the FDA. And he called that warp speed because he's a Star Trek geek. And before the White House started calling it that, before White House was even aware of it. And Peter Marks said we should get money for Congress to do high-risk manufacturing. So these people who have been so maligned, as you know, not Peter Marks, but Rick Bright is a whistleblower. The civil servants have been so maligned by the president and by this administration. And, one would get the sense that they're, deep state, disloyal, whatever. But these are the real heroes here. There's lots of heroes, and I don't begrudge credit for anybody for getting these things done successfully, because all the vaccines, like every other good thing, are a massive team effort. But I think as the story emerges, there will be, that will be there. And it's not a uniquely American thing, as you know. BioNTech in Germany, Oxford in England, all around the world. And it's not a story sadly, of U.S. collaboration and cooperation. But it is a story of science, absolutely kicking butt. You should be very proud.
We're probably just about a week away from vaccines, maybe starting the rollout across the country, which is incredible. You did a great podcast yesterday about the vaccines and about their dissemination. Do you feel optimistic or pessimistic about how the rollout will go, and why?
It won't go perfectly. But, it depends what our expectations are. Sadly, I don't think the public is willing to give the process any time. Like, I think people will be barbecuing on Memorial Day, whether we have a vaccine or not. So we have to run pretty fast at this. I think, in terms of how we're going to see where our readiness is in each of these processes, I think we're actually quite good at having a vaccine that is going to do far better than we thought, which essentially means we don't have to give it to quite as many people for us to reach herd immunity. I think the manufacturing is going to be a challenge because we're going to be a little bit behind, but I think we're talking about weeks, not months. In other words, if you're not in group 1 or group 2 or group 3, you'll be in, it's not a matter of like, okay, you're not going to do it for months and months. It'll be probably a matter of weeks. I think our distribution system, whether it's FedEx for Pfizer or McKesson, are good logistic partners. And then the last mile, right, is you're at the CVS, you get a call, you get a note, you got to come in, and you got to come in a second time, you got to be scheduled and all of that. And then of course you can't be at the CVS with 700 people, you got to be in there, one at a time. And I think they know what they're doing. I think they have, from everything I can tell, they've been deeply engaged in this. So there'll be bumps. We'll be following it closely. But in the big picture, if we should get it done by May or June, and instead we don't get it done till July or August, that's still an enormous success. In fact, getting it done in 2011 is an enormous success.
Well, that would be, except it'll be 2021. 2011 would be incredible.
2021. 2021. Thank you, Sarah. Yeah. Yeah, if we get it done in 2021, it will be, I think, a great success. And if you certainly record time to get it through. I think we'll get it done. I think we'll get it done the first half of the year, from everything I can tell. But if it takes a little longer, I know people are impatient, but it's still pretty incredible.
Yeah. So each state's handling of the pandemic so far has been really individual and all over the place. How does that play out in terms of vaccine dissemination? And is that individuality a problem?
Yeah, I mean, it has been a problem. It's this, states are not set up to manage disasters on their own. They don't have public health departments set up to do it. They don't have the capital resources. They can't do what they want to do, which is close businesses, but keep them whole and keep them from closing. So the federal government had a much bigger role to play in all of those things, including procurement. And so we need a much more coordinated effort here. Hopefully, most states will just follow the ACIP guidelines. And there will be some interesting public debate. When should teachers be vaccinated? When should they be before or ahead of others, college students, et cetera? But I think, we have thought through, near as I could tell, we've thought through most of the big chunk issues in most states. God, I hope that there will be states where we have really complex challenges in terms of rural populations. I don't know how to do this in Alaska, right? So there will be certainly bigger challenges. And if you've got states that have hospital capacity issues to begin with, then you obviously have to keep people away from hospitals and make some adjustments. And each of these states have different levels of skill at this. But, the thinking that went into this from the U.S. Army has been good. And, the ability to get the vaccine from here to there, we know how to do it. I hope that we got to hope that as many people as possible come back for their second booster, things of that nature.
Right. In terms of that, actually, when sets of the population begin to get vaccinated and they get their first dose and then their second dose, we're all kind of in the squishy middle for a while, or some people are vaccinated, some aren't, some are halfway. Do you see a system where there's some sort of badge or passport you have for proof that you have been vaccinated, and then therefore you go back to college, or you can go to work, back to the office, or something like that?
Sure. I think we have a low tech. That's what we have today, low tech, right? You can't go to college unless you get your vaccinations, right? You can't go back into certain schools. And I think with things like sporting events and music events, et cetera, I think you see organizations like Clear getting involved. I think there are partnerships between like StubHub, Clear, and different sports and music leagues where you'll be able to either confirm your vaccination or get a test as you're buying tickets to something. And it's just become part of the social compact that you don't go into large events or large spaces or large crowds with other people if you're at risk. So I do think that will become more of a norm. And look, at the same time, massive reductions in community spread will start to make them less and less necessary over time. Not this year, not 2021, not 2011 either. But over time, we'll have very low levels of community spread. The way I talk about it is presumed guilt versus presumed innocence. That's the flip over point. So if I ran into you in the street, Sarah, and you weren't wearing a mask, I would have to presume that you might have COVID-19 not because I don't think you're safe or healthy, but just because we all don't know and it travels asymptomatically. So we would be cautious, and you would assume that I might have it. We would be cautious. At some point in time, the community prevalence will get so low that I'll run into you in the street and I'll assume you don't have it. And that'll be back to the way we used to think in 2019. And if you were seeing a friend, you'd give them a hug and you wouldn't think twice of it, because the risk would be so low. The vaccine will help us get to that point. The vaccine plus mask wearing for a while will start to get the community prevalence so low that the chances of us running into each other and one of us having COVID-19 would be incredibly remote. Risks are never zero. But when we get back to that point, some habits will stick, right? We may still wear masks in the wintertime. We may never shake hands again, because we may not wonder why we ever shook hands to begin with,
Sure.
right? There may be a whole new set of habits, particularly for certain types of year.
What is, when you say so low, I mean, this is always the question, like what is the threshold for when it flips, where the presumption of guilt versus the presumption of innocence, or the threshold for when you actually go in for a hug? Like, what is that point?
Right. So I'm going to say it depends on one factor, which is your own risk prevalence. So if you're 85 versus 35 or 25, it's a different answer. If you have diabetes or something like that, it's a different answer. So I think you're going to be a rung removed. But I think you just go back and look to the measures that were rolled out by Deborah Birx back in April that were never followed by anybody. And you have prevalence levels per 100,000 that are really, really low when you get to green. And there's something called European green, which is a level that they got to in Europe. Australia, I don't know if people saw the videos of they just had these massive street parties because they got to a level of COVID that was like 0 new cases in a day for some period of time. And they just had massive street parties because their chances of getting COVID were literally approaching 0, if not 0. So it can get down to that. It doesn't seem possible, but the way the math works is actually interesting. Just like we have exponential growth, there's a parallel concept called exponential decay. And exponential decay is actually a good thing, even though it sounds kind of goofy and eerie, but it's like it's when exponential math works in your favor. It's how 100,000 cases a month later becomes a dozen, because if you've got the R naught, not to use too many technical terms, if you got the R naught below like 0.5, which means that every person's spreading it to less than half a person, you start to grow. You start to take that number and multiply everything by 0.5, 0.5, 0.5, 0.5. You're cutting stuff in half really rapidly. So that can happen quite quickly, but we shouldn't jump the gun either. I mean, we should just be checking out those tolerance levels. And I think the good news is, it's your point about the election. We'll have a CDC that my presumption is will be very clear and very specific about what those numbers need to be.
That's great. I look forward to the day with specific and clear instructions. One more question about vaccines for you, which is vaccine hesitancy. Like, there's been a lot of rumbling about vaccine hesitancy and how some Americans may not get the vaccine because of mistrust or misinformation, distrust and misinformation, excuse me. Other experts are saying that, this is overblown, and actually talking about it all the time normalizes it, makes it a thing. What do you think?
I'm going to be talking to the people from the Vaccine Hesitancy Project for my podcast next week, and the Vaccine Confidence Project, which has done a lot of work in this area, and I've done some reading in the meantime, and it's interesting. I mean, I guess I don't know how worried to be about it, to be honest, Sarah. If you have I don't think there's, so look, first of all, if you're worried about political interference in the vaccine process, all you have to do is look to the fact that Europe already approved the vaccine, right? They don't care. They were not involved in our political process. So I think we have really outstanding kind of reference points. The data is incredibly strong. Some people are. Look, there's a set of people that will never take the vaccine. Fine, we understand that we're not. No one's going to convince them. That's not a huge part of the population. There are others that maybe they don't like needles, or maybe they don't want to get a second dose, or maybe they've got other types of concerns. We need to listen to what those issues are. I don't think the answer is bullying, right? People into taking it, but to listening. I think we need probably 70% of people to take the vaccine, and I think that's achievable. I talked to people who are very different from me politically the other day, extremely different from me politically, and they said they're taking the vaccine. And I asked if they would be public about it, and they said they will be. It would be great if President Trump publicly took the vaccine and told his supporters to take it. I don't think he will. I suspect he will do the opposite. But if he did, that would be great.
So speaking of administrations, let's talk about the Biden administration. You have said that you don't just expect not Trump, that you expect repair. Can you talk a little bit about that for us, what you mean?
Yeah, I had this conversation with David Frum, and he said, he said something that stuck with me. He said it's really impossible to get an A managing a vaccine, managing a pandemic, but it's a no-brainer to get a B. Because, to get a B, you need to demonstrate some amount of compassion and empathy, and, a decent level of competence, and people will give you a lot of credit. So it's almost remarkable that we have had a president that has been unwilling, in my opinion, I don't know that everybody agrees with me, but to show any amount of compassion or competency, or just level with the public, just to say, look, here's the situation. It's not so good right now. It'll get better, but it's not so good right now. So repairing those things is a no-brainer, right? Because that's a low bar. So demonstrating compassion. The president-elect himself, I think, because of who he is and what he's been through, will do that. He will talk to the public that way. The people around him, the people he's brought in, they will be competent. And we will get the straight answers, and we will get the truth. But we have to, unfortunately, that's not the job. The job is to build back. It's to fix the things that aren't working. And so the fact that he named someone to run, for example, the impact on health equity and health disparities, that's like saying, okay, we don't just have to be good at this. We have to fix the things about our country that were shown to be broken. And it doesn't happen automatically. It doesn't not just saying, I'm not going to discriminate doesn't heal those wounds. Going in and actually saying, what are the structural issues that cause these problems, that cause Black Americans that affect it to be, get the equivalent of 10 years older in terms of their reaction to the virus. Think about that. If you're a 60-year-old, you're 70 from the purpose of the virus, given all of those structural issues. And it's not, we've looked at the data, it's not based on anything genealogical, it's based upon exposure levels. So we have, so putting in place an infrastructure to deal with something like health equity and health disparities, not just saying, okay, we're going to get hospitals running, but we're going to get every nurse and doctor masks. Not just saying we're going to have more tests, but we're going to have the kind of tests that are going to allow people to go back to school specifically. Those are the kinds of things that I think will really help us.
Great. So this is a wishful thinking question, but I'm going to ask it. When Biden comes into office in late January, Will there be any tangible differences that we notice immediately? Like, will it feel like a switch has flipped?
I think in some respects it might, because I think we'll start to feel like we're getting clear, compassionate communication, hearing from the science. Um, I think it will feel like we're getting, we're seeing the progress as it happens. We're getting told the truth. That doesn't mean it'll be instantly better. But we will also, and I think it would also mean we're going to have things asked of us, right? I mean, you can't imagine you get through a crisis and say, I'm willing to do nothing. I'm not willing to wear a mask, not willing to change my behavior. I'm not willing to not go to the Alabama football game. I'm not willing to do anything. Zero. That's what the president's asked of us. Absolutely zero. And so that doesn't work. That's not reality. There's nobody promised any of us that during a pandemic we'd get to have everything we wanted. So when he doesn't ask for things from all of us, instead he exports the pain onto a few of us and says, okay, if everybody doesn't contribute a little bit, then some people are going to pay the ultimate price. And so what I think President-elect Biden's going to do is he's going to say, let's all give 1 or 2% more so that we can save a lot more people's lives. And he's going to use the bully pulpit, which has been vacant, in my opinion, for the last year. And we need to hear those things, because I know a lot of people who, if they're just asked, what is it that I can do to help? I can't tell you how often I hear it. I'm sure you do as well. What do you need from me? What can I do to help? And a lot of people are figuring it out on their own, or have figured it out over time. But I think we'll get it in a more clear, consistent way, and that's got to help, I imagine.
That I think it would help. You touched on this, but I just wanted to make sure we covered it. That Biden announced key members of his health team yesterday, including the heads of CDC, HHS, the Surgeon General, and an appointment for Dr. Fauci. Any surprises in these selections? What do you think of them?
So I don't know the woman who has been asked to run CDC. I've never met her. I've heard really good things about her. So in the sense that, I don't know if I call that a surprise, everything I've heard is she's the exact right kind of person that we need right now. The Javier Becerra to run the department is, I think, an excellent choice. I love the idea of finally combining health and justice as kind of a powerful concept for our country. We never have needed it more than we do now. And he's a wonderful person. I think he'll be great. Jeff Zients to run the pandemic response. I mean, I don't know anybody more competent and more execution focused than Jeff. I think he and I worked together on the ACA turnaround. And, I just think he's amazing. I'm so grateful he was willing to do this. So I think we'll name, and then, Fauci's role, it's great. I mean, that should bring a smile to everybody's face. Vivek is one of the most empathic and compassionate people that most people who've met him have ever known. And then all of them have another quality, which is that we've been missing, which is they all are trusted by the president or the president-elect. And when you have a set of people to whom, like we've had now, that don't know the president's mind, and so they go out and say, Deborah Birx, who is a perfectly good scientist and communicator, and goes out and tries to do something, and then he undermines her, or says something different, or then she doesn't even go out and say what she means anymore. And you have some relatively weak people in CDC, in HHS, and FDA, who just kind of want to know what the president wants. They don't want to tell him what's right. You end up with a place where any dissent gets squashed, and you end up with a place where any kind of people just sort of crawl into a shell. So I think we're going to have a place where people who will all very much be on the same page, which the public needs to hear. And I think they'll keep adding more good people. I mean, I've been helping out where I can in the process of looking at people, vetting people, and they're just incredibly thorough. And they're looking for people who look like America. They're looking for people who have actually experienced challenges personally. They're looking for people who are the best at what they do. And they're looking for people who are team players. And by team players, I don't mean like loyal to a fault. I just mean people who aren't looking to get a lot of credit for things. So and I think a lot of that is Ron Klain, to be honest. I think Ron has, he's just got a lot of wisdom in terms of how these things can work best.
Great. I want to talk for a minute about the war on truth and science, just as part of this administration transition. So in this new administration, how can we change the minds of people who are COVID denialists and also who are questioning science and scientists? Or are people just too far gone, or do we not try?
So look, I think this is a bigger question caught up in bigger waves than even the pandemic, right? It's a sort of how tribal we've become. I try to explain it to people this way. It's like, let's say I don't know what your religion is, Sarah. Let's say you're Protestant, and you meet a priest who you love, and a Protestant kind of pastor who you don't love them, but fine, they're okay. Then people ask, well, why didn't you go to the priest on Sunday? Why did you go to see the Protestant service? Well, I'll say that's who I am. I wasn't evaluating what I liked better. That's my identity. And so in this country now, a lot of these things that shouldn't be part of our identity are sort of part of that package. You sort of do what your tribe does. And if your tribe says they don't like masks, your identity in the tribe is far more important to you than any specific individual decision like whether to wear a mask or not. And that's where people have I think have it wrong in terms of communication, because they think that people can be persuaded or logicked or bullied or what have you. And to some degree, some people can be persuaded with logic and emotion and experience, but we have a far deeper set of issues, which is kind of how do we identify. So Biden's big challenge, and of course he's making this about patriotism, and maybe that'll work for some people, and I suspect it'll work for some people, but for a lot of people, reaching people. I just did an episode that comes out tomorrow on how should Biden reach Trump country with his messaging and his communication, and simply saying, look, this is public health. This is not a political issue. You would think would work, but if they're getting counter messages, then it becomes very challenging. As people aren't. Everybody's not reading my Medium posts, right? People who agree with me are probably more than people who don't. Not that people don't disagree with me, but the people who don't like what I have to say in general are not likely to read it. You've got how many little niche, Elemental, and you got all these other things because people want to get the information that appeals to them. And so we live in a world where we want to satisfy our need for who we are, for what our tribe is and what our tribe wants. And that's the kind of part of the whole In the Bubble podcast is making exactly that point, is we're all in our own bubble we define. I'm not even sure what your original question was, so I apologize if I went off and these kind of crazy.
Covered many topics. And by the way, you're really good at segueing to my next question without even knowing what my next question is. So we're having some sort of mind meld here. I wanted to end with some lessons learned and talk, you just finished your book, right? Writing your book. So congratulations. And I know when we talked a few days ago, you were saying that kind of originally you had thought this book would be basically, uh, all of your posts kind of with more color and context, and this would be kind of the framework, but that when you really got into thinking about it and writing about it, it was a much more introspective, kind of intense process, and stepping back and thinking about kind of how we got here and how much of that was about Trump and how much of it is about the failure of due to underlying things about us and about our country. So we've talked about that a little bit, but I wanted to ask this question, which is, if we went through this pandemic again and Trump was not president, how would it be different? Or what would it be like?
That's like the ultimate question that I try to get to in the book. The book's called Preventable. And I wanted to write a book that would read like The Big Short around 2008 issues, and really be kind of a readable, on the ground look with occasional jumps up to 10,000 feet, so you could kind of see what some of these lessons were. And of course, in the process of writing it, you make these discoveries around things that have been deeply wrong and deeply challenging. And of course, Trump didn't come out of nowhere, so it's impossible to say that this was driven by Trump, because the same causes that caused us to elect him are some of the same things. We have a lot of unexamined issues that we need to have dialogues about. But I came to believe that we are more. There's a lot of things about us. We tolerate inequality much more than most countries do. We have very little collective will. We have very little recent experience sacrificing, certainly for one another. We're very comfortable, and we're hesitant to give up even the most highest of those creature comforts. And the real question is, are we introspective enough to come away and learn the lessons? I know we'll learn the literal lessons. We always learn the literal lessons. Like, we'll have enough PPE next time. That won't be a problem. But will we learn the more fundamental lessons? The hope is that in other parts of the world, where Hong Kong, which has the most cross-border travel with Wuhan, has had fewer than 100 deaths. It's at 104 now, because they're just practiced at this. They get it. They care. I think the thing that people have to understand is that, I think one of the things that happened here, Sarah, is that certain people who could isolate safely, who were white, who were more well off, who were younger, as soon as they started to feel safe, started to feel very impatient. And so all you got to ask yourself is, what if next time this doesn't prey more on older people? What if it preys on kids, like the measles? What if it preys on people that golf, right? Could be you next time. So, our attitudes change, and it's not entirely because of racism, although that may be some of it with some people. It is because human nature is such that as soon as we start to feel safe, then we start to crave and recognize the things that we want. And I spent a lot of time with sociologists and risk managers and all of this. This is all stuff I've learned, not stuff that I knew going into the book. It helped me understand how we do process things, because we're self-protective. We don't want to live in fear, right? We don't want that fight or flight brain on. So we start to go, oh, this isn't happening to people like me as much. I'm not as afraid, and therefore my behavior changes. That happens with everybody, not just people with bad intent.
So thank you, Andy. I think we have time for, 6 minutes. So 1 or 2 questions. If anybody has any, please put them in the chat. I wanted to ask you, while we're waiting, what does next year look like for you professionally? And I know you have this incredible book that's coming out, and I'm sure you'll be doing lots of talks like this one, but what does it look like for you?
So, I have I do several different things. As you mentioned, United States of Care is a nonprofit that I founded a couple of years ago that, we're dedicated to try to get every American healthcare and never have to worry about healthcare again. So I will spend a fair amount of time, hopefully, on that, working with the administration and states and others to do that, because that's a passion. I founded an investment fund called Town Hall Ventures, which invests in underserved communities in healthcare to try to bring healthcare to underserved communities. So I will spend time on that. It'll be an interesting question. The podcast has been a delight to do, and as things get better, I'll do it as long as people want to keep hearing it. But so we'll have to see what happens there. But I enjoy that. At some point, I'll probably stop writing these daily threads because they fill up people's timelines. So, we'll get back to normal. I think there's a lot of repair work to do. I'm blessed to be someone who my passion happens to run right into the kinds of things we needed this year. And if that's the case next year, I'll keep doing those things for as long as needed.
Thanks so much. I'm sorry that I'm muted. I hope you weren't thinking I was rude, but my husband is next door on a Peloton being incredibly loud. So sorry about that. I think we are in good shape, and I just wanted to thank you so much for being here and for a fascinating conversation. And thank you just so much for your service. I mean, it's just absolutely has been a huge gift to and a lifeline for a lot of people. So I really appreciate it. I once again urge everybody to follow Andy on Medium and on Twitter. You will never regret it. Listen to In the Bubble, buy the book, and please make sure to always read Elemental and the Medium Coronavirus blog for all of your pandemic needs. And once we get out of it, all of your health and wellness needs too. So thank you so much, Andy. I really appreciate it. And thank you to everybody for coming and attending Medium in Conversation.
Thank you, Sarah.